Heart disease can strike at any time. In North Carolina, it takes a life every 20 minutes. How do you know if you're at risk, and what can you do to improve your cardiovascular health? Find out next on Healthwise.
Funding for the Healthwise series is provided by...
I was sort of in denial of my diabetes. I was 380 pounds. I called a nurse with Blue Cross and Blue Shield. She sent me volumes of information about diabetes. I enrolled in a program called Healthy Lifestyle Choices. And what it is simply that, changing the way you think about food, the way you think about exercise, the way you think about life. I've lost 70 pounds. My diabetes is completely in control. Keep an eye open for me because I plan on losing a whole lot more weight.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.
And welcome to Healthwise. I'm Christine Rogers. Heart disease is a serious health problem in North Carolina. It accounts for more deaths than all forms of cancer combined. 1 in every 4 residents in the state has some form of cardiovascular disease. What is the state doing to address this problem? What new medicines and procedures are available for cardiac patients? How can you lower your risk of heart disease? We hope to answer these questions and many more. We've assembled a panel of experts to take a closer look at this important issue. We also want to hear from you. In a moment, we will provide a phone number where you can call in with your questions and comments. We begin by taking a look at how some heart patients are taking steps to live longer, healthier lives.
Active and seemingly in good health, Joe Catarino never suspected he was at risk for heart disease until he recently went in for a stress test.
And the doctor with his mask on walks around with his eyes open like that. Joe, do you see that? And I says, yeah, you got 99% blockage in your main artery. He says, that's the widowmaker.
Okay, let's hook you up and see what we get.
I'm a running good.
A 1-inch stent was immediately put in to open the blockage. Joe admits he didn't really feel any different after the procedure, but he knows the type of blockage he had could have proven fatal.
That's why they call it the widowmaker. It's the guy you see or the woman you see walking is healthy, is walking around, all of a sudden has lunch, walks out and dies for a heart attack. That's the one I had. So I was very lucky. I missed the bullet on that one.
Julie Mayhew is another cardiac rehab patient who believes she's lucky to be alive. Only 38 years old, Julie suffered from shortness of breath, extreme fatigue, and nausea. Her primary care physician referred her to a cardiologist.
Because the stress test didn't show anything, he said there's nothing wrong with you. And he told me I probably needed to go see a stomach doctor, that it was probably my reflux. So I found out later that that was told to a lot of women, because most of the women in here were misdiagnosed the first time. And most of them had heart attacks because they were misdiagnosed the first time.
Okay, Julie, let's see what your EKG shows.
A visit to a second cardiologist and a catheterization confirmed what Julie suspected. Something was very wrong with her heart.
And when she got in there, I think she was even surprised. I had one artery was 80% blocked. One artery was 100% blocked and still is.
The test looked great, and I don't think we need to change any of your medicines.
Okay.
As director of the Women's Heart Program at UNC Chapel Hill, part of Dr. Paula Miller's mission is to better educate women about their risk for heart disease. She says too often women naively assume it's a man's disease and not one that will affect them.
Even between 97 and 2000, we didn't make any headway. Every woman still thought, or 2/3 of the women still thought they were going to die from breast cancer. And cardiovascular disease was like 8th on the list, when it's really number 1 on the list and kills more than the next 16 causes combined.
All right.
Just need you to lie back for me.
Okay.
At 80 years old, Patricia Sheffy doesn't take her heart health for granted, especially after she had a scare nearly 5 years ago.
Well, I had not felt well for several days, and I had a very rapid heartbeat. And then one evening I just started having these, severe chest pains.
Patricia Sheffy never had a heart attack, but now she takes medicine for her high blood pressure and comes to the doctor every 6 months for an echocardiogram.
It's a beautiful sound.
It really is.
We were looking to make sure that her heart muscle had not stretched out, that her heart muscle was not thickening, that her valves were still working, that there were no wall motion changes to say that she'd had silent heart damage.
Take a little breath.
Her particular case, she's doing great. She participated in cardiac rehab. She walks every day, or most every day. She watches her diet. She does all the right things, and I think that's why she's done so well.
And it's just like a small crunch like here and back up.
Exercise is a top priority for cardiac rehab patients. Sam McCullough is a recent graduate of the Wake Med program in Raleigh.
I met all my goals. I had a goal of lose 8 pounds. I lost 13% body fat. I gained 7 pounds of muscle. My quality of life improved 23%. And it was just a great time for me.
Sam had his first heart attack at age 59. Now 68, he recently underwent quadruple bypass surgery.
I was surprised when the doctor recommended I have open heart surgery. Again, I was doing my exercise. I was playing a lot of golf. I was able to walk a minimum of 3 days a week, 3 miles a day, without any problems. And I was surprised when he said to me that I needed this bypass surgery.
And slowly relax. Bring your arms to your side.
Rehab experts say for many of the patients here, confronting their heart disease provided them with the motivation to make lifestyle changes.
Cardiac rehab really is multidisciplinary. We're trying to help them learn to reduce their risk for future cardiac events, and to do that not just through exercise, but also healthy diet, stress management, just incorporating all those things into their lifestyle.
You got me working now.
They have had a wake-up call, so they're interested. How can I age slower? How can I feel better? We try to find ways that they can live in a normal way, but still have improvements so that their blood pressure starts to look within normal range. Their blood sugars are coming down nicely, and they're feeling better.
This has helped me a lot. This being here, the first week I was here, I noticed a difference. And I haven't lost any weight or anything like that, but I feel better. Mentally and physically, I feel like I have a little bit more energy, which has been a long time since I felt like I had energy.
I was reluctant at first, but it made a big difference in my life. I was looking for a way to exercise 3 times a week for a future, for my lifestyle, and this kind of forced me into it, and I'm going to be in it probably the rest of my life.
The weight, very good. My blood pressure, very good. My diabetes, in control. I know it's hard to understand, at least I can't understand it, I guess, but my health is better than it was 15, 16 years ago.
To help us take a closer look at the problem of heart disease in North Carolina, we have a number of experts who are generously giving of their time and expertise. Joining us, Dr. Christopher Granger. He's an associate professor of medicine and director of the cardiac care unit at Duke University Medical Center. Dr. Rick Stauffer is director of interventional cardiology at UNC Chapel Hill. Dr. Donald Ensley is vice chairman of the North Carolina Heart Disease and Stroke Prevention Task Force. He's also chair of the Department of Community Health at East Carolina University and a former former chairman of the board of directors for the North Carolina Heart Association. Dr. John Sinden is with Raleigh Cardiology Associates, which is located in the Heart Center at the Wake Med Raleigh campus. Dr. Joseph Babb is a professor of medicine in the Department of Cardiology at East Carolina University Brody School of Medicine and the director of the Cardiac Catheterization Laboratories at Pitt County Memorial Hospital. Also joining us is Dr. Carlos Ferrario. Dr. Ferrario is the director of the Hypertension and Vascular Disease Center at Wake Forest University Baptist Medical Center. He is the recipient of numerous awards for his work in the understanding and treatment of high blood pressure and vascular disease. Thank you, gentlemen, all of you, for being with us. We appreciate your time. Reminder to our viewers, if you would like to join our conversation, you can call us at 1-800-555-3120. Dr. Granger, if I can start with you, because a lot of the people that we profiled in that piece had a stress test. It was a stress test that really was the indicator that they were having a problem. And it might raise the question for some viewers, well, when is the right time to have a stress test? There are many different kinds, and which one's right for me?
Well, stress testing can be very important, as we saw in some of these patients, for certain individuals. And it's primarily those people who are either at very high risk for developing heart disease or who are having some symptom that means that they may be having the first signs of heart disease. For example, chest discomfort or shortness of breath with exertion. For people who have diabetes and are over the age of 40 or so, that may be a population that's particularly important to have a stress test.
And I'm wondering too, Dr. Stauffer, it might be good at this point to also talk about what are some of the risk factors for heart disease? What do we need to be thinking about?
Well, the first thing to say is the risk factors we know only explain part of the pictures, but the classic ones are high cholesterol, diabetes, high blood pressure, smoking, especially cigarette products, obesity, and then there's other ones which we less well understand, like genetics. For whatever reason, some families pass down genes that lead to early vascular disease. But having said all that, we still see a sizable number of patients who have none of the discernible risk factors and still end up with heart disease.
And Dr. Ferrario, I know a lot of people talk about hypertension. That's your area of expertise. What do we know about that connection and heart disease?
Well, one of the things that we are learning is that the definition of what high blood pressure is changing rapidly. Until very recently, we consider that a patient whose blood pressure was greater than, let's say, 140 over 90 millimeters of mercury would be considered hypertensive. But we are actually learning today that the pressures between, in terms of the systolic blood pressure, between 120 to 140 are really beginning to initiate the process of high blood pressure, and that the vascular disease may actually precede the level of blood pressure. So many of these patients who have a heart attack or who have a coronary artery disease, and that we had difficulties in determining what was the risk factor that could be associated, it is probably reasonable to think that these are the group of patients whose blood pressure was still in what we call the pre-hypertensive stage, but it was still in the process of developing high blood pressure.
And the scary part about that is people don't necessarily know if they have high blood pressure.
That's correct. And that is the major problem right now, which I think is going to be very important in addressing, is what type of tools we can use to detect those individuals at risk before they become hypertensive.
Dr. Inslee, I'm just wondering from a public policy standpoint, when we look at the statistics for North Carolina, they are not very encouraging when it comes to heart disease and stroke. What is the state doing to address this problem?
Well, I think one thing we recognize that it is a problem, and we recognized this a long time ago. Fortunately, the state has put together a task force, which is the Justice Warren Task Force, and we've been addressing some of the issues that have been spoken to already for the last 10 years. However, there are many problems with this. One is trying to encourage the community and people to really make those life changes that they need to make in order to reduce the high rate of heart disease and stroke. And so really it's an education process that we're going through and attempting to educate the public as well as our policymakers.
Right. On the subject of education, it might be worth underscoring. Dr. Sinden, most people probably know those classic signs of a heart attack, but it might be good to repeat those and perhaps mention that not everyone has all those classic symptoms, do they?
That's true. You know, the classic symptoms typically are pressure or tightness in the chest, a sensation, oftentimes radiating into the arms, usually the left arm, sometimes into the jaw. I think most of us on this panel would agree that it's not the very common patient that has those typical symptoms. Mm-hmm. We saw earlier a piece about women. Women frequently have atypical symptoms. Diabetics especially are a group of patients that have very unusual or atypical symptoms. Sometimes may have no symptoms at all. Right. Patients may have had a family member or someone who's had a silent, what we call silent heart attack, and those are oftentimes diabetics. So I think, but it's not just women. I mean, some men have unusual symptoms. So I think anything that's perceived as unusual, a sensation, a pressure, that the patient thinks is unusual, they should really seek medical attention.
Dr. Bebb, is your experience that a lot of patients tend to ignore those things, perhaps, and wait too long before they seek help?
I think they both ignore them and deny the implications of them. Most of us would think that you might have a heart attack, but surely I won't.
Right.
So they have this symptom and they think, oh, it's that meal I had or that piece of meat I ate or whatever, and they attribute it to some digestive problem or the work I did in the yard today, and they don't want to acknowledge that this is unlike any other symptom that they've had. So I think this is a matter of public education, and we as a physician group, we as a healthcare system would far rather have somebody come into our office or emergency room and be able to pat them on the back and say, you know, it was a pulled muscle, than have somebody ignore a potentially fatal symptom like this chest discomfort that was very well described. So I think it's a combination. They ignore it, but they also misinterpret and hope that it's not what they are afraid it might be.
Better to be more cautious.
Joe, I have actually some recent information. Just today we were looking at North Carolina information about how long it takes for patients to come to medical attention when they have a heart attack. And it's about an hour and 20 minutes before they come to medical attention. I think it's really important for people who are having these symptoms, especially people who are at risk. For example, anybody over the age of 50 who has any of these symptoms, or anybody over the age of 30 who is having chest pain, to call 911 right away. That's the key, isn't it, to getting into the system?
You're absolutely right, Chris. And I know the American Heart Association has funded projects across our country at trying to improve public education and get people to call 911 sooner, without the kind of results that we had hoped they would have. But if people would simply do that, we know that if you are having a heart attack and we can open the artery that's closed with that heart attack in a timely fashion, we can certainly reduce the death rate and reduce the amount of heart muscle damage. And that's the whole statewide initiative that you and your colleague, Dr. Chalice, are leading us on, this RACE initiative that you've started.
A reminder to our viewers quickly, our phone number is 1-800-555-3120 if you'd like to join our conversation. And our first caller is Charlie from Guilford County. Go ahead, Charlie.
Yes, I'd like to ask the doctors the importance of taking coenzyme Q10 if you're taking statin drugs, and also maybe taking folic acid to prevent homocysteine. Thank you.
Who would like to tackle that one?
Well, I'd be happy to start. I think you bring up a really interesting question. That we get a lot of questions about what supplemental treatments might be helpful and what medications are helpful. And I think the most important thing is to be adherent, to